Hello, low carbers. Welcome once again to this Low Carb Health Doctor podcast episode featuring the Stanton Migraine Protocol. In this part 2 episode, we shall learn more about how migraine headaches may be controlled or averted in the real world without medications, especially by using a low carbohydrate diet approach. If you haven't watched part 1 of this special episode with Dr. Stanton, you can find the link to that video in the description below. So we have once again Dr. Angela Stanton. Watch this video till the end to get the most out of this episode. Like this video and don't forget to subscribe or follow the Low Carb Health Doctor channel, podcast, and other social media platforms. So welcome once again to the Low Carb Health Doctor podcast, Dr. Stanton. So at this point, what I am personally curious to know about is your own experience. How in the world did you get into this Stanton migraine protocol? What's your personal story behind it?
Okay, so as you remember when you read up all my education. So I think the secret to have come to this particular conclusion was based on my mathematics and my engineering background, because that requires a different kind of research into the field of sciences to sort of kind of understand and connect the dots better than what we can see when we're just looking at medicine. And so my personal experience is that I've been a migraine sufferer since my very early age. I think I was probably about 11. I can't remember exactly, but I was in my early teens. And my migraines at that time were presenting in a very atypical migraine way, which was not considered to be migraine up until I think I may have been the one who first said that I think this is the child presentation of migraine. And those were the cyclical vomiting syndrome and the irritable bowel syndrome kind of behaviors. And so that's what I had. And my mother and father, they were just told she probably just ate something, she's going to be fine. But it was seasonal. It was always in the summer when we had seasonal access to fruits and sugar. We normally didn't eat sugar when I grew up. In the 1950s, people didn't eat sugar and didn't eat a lot of junk food or cereal. These kind of things were unknown to us. And so basically, the only time I ate carbohydrates was in the summer. And in the summer, I would be always sick. And so it didn't occur to anyone that maybe there's a connection. And then as I got older, and I think for a number of years, I don't recall having migraines. I don't remember if I had or if I didn't. But when I turned into my late 20s, after the birth of my second child, I started getting migraines really badly with the pain. And it increased in intensity. So, as a neurologist, you hear it many times that migraines will reduce in a woman's life as they head toward menopause. And then when they get into menopause, there won't be any migraines. Well, that is not true. In fact, my Facebook group is filled with women who are menopausal or postmenopausal, and the migraines have increased over time. And so not only did it stop, but it actually increased. And so by the time I was in my mid-50s, and I was teaching at that time at a university, as a professor, and I was also doing research in Germany at the Max Planck Institute, I became absolutely what I would call useless. I mean, like between classes, I would curl up in my office, put two chairs together, and I would lie down and would take my migraine medications. And basically, I was going from headache to headache. And I would have migraine headaches for 5 days a week, and then 1 day of prodrome and 1 day of postdrome, which would be feeling sick the day after. So I didn't have any time off for migraine. And so at that time, I decided to quit working. So I quit both of my jobs. I quit the academic teaching job and also my research job. I came back from I was in Germany at Max Planck Institute, and I just simply 1 month earlier than I was supposed to have left, I just packed up everything. I said, I'm leaving. I'm going home. That's it. I'm quitting everything. And I was, I think, 55 at the time. And I decided to fully immerse myself in migraine to understand it. And I read everything possible. And I started thinking what it possibly could be. Now, I was partly in neuroscience, but not specifically as deep as like you would have been. And so I wasn't thinking in terms of neuroscience. I was thinking more in terms of the cell. So what would hurt in a cell? What would cause the trouble? And then as I was building up from the cell, using all the mathematics and engineering tool sets that I had, it slowly kind of evolved that, well, it would have to do something with the supply into the cell. And very specifically, in the case of migraine, something with the neurons with respect to the electrical properties, but I didn't quite understand what that was. And so I tried everything, the usual supplements recommended, like B2, magnesium, sugar, all kinds of herbal remedies, all kinds of medications, of course, I've tried everything basically that one could try. And nothing was working, but totally by accident. One day I started to try salt. I said, well, I haven't tried salt yet, and I don't like salt. So I said, okay, let me try salt. And that worked. And that worked just enough to reduce that particular day, that migraine. And that sort of stopped me in my tracks. And then I started to apply the salt again and again and again. And so I remember my mother was still alive, and we had a helper from my mother. And so she would see me in the morning, go down and take a pinch of salt with a cup of water, and she would look at me like, what are you doing? And she too was a migraine sufferer. And I said, well, this helps. I had no explanation at that time. And so she tried it too, and it helped her as well. And so we sort of kind of got into taking salt every morning. And then I started to get into, I went away from literature in migraines and instead went on to literature in understanding the brain electricity, the physics behind it. So went into heavy-duty mathematics and physics and electrical engineering to understand the brain. And I discovered a lot of academic articles in that field that were actually done on the brain, but are not considered to be part of the neuroscience academic literature in a sense of value, because it was just too much physics or too much electrical engineering involved. But those were the most important academic articles that showed me, for example, that the electricity in the migraine brain is not only different in magnitude and amplitude, but also it comes, even the resting potential is different. I mean, everything is different in a migraine brain. And so once I started to understand that it's all about the electricity, and I have to look to see what is participating in electricity. And just about at that time, I bought a book, which is right here. It's called The Manual of Medicine by Harrison. I have the 18th edition. And on page 4, it says that when glucose enters the cell, sodium leaves the cell. And I said, duh, that is so simple. If you eat carbohydrates and glucose has to enter the cell and insulin is not used to deliver glucose in the brain, it has other functions, then it's sodium transporters that take glucose into the cells in the brain. And so if I'm eating carbohydrates and I'm using glucose in my brain, predominantly glucose, then I am always chasing sodium out of my neurons. And so the very thing that would help me create the electricity that I lack, I'm taking away by eating carbohydrates. So this is how I connected it to the carbohydrate basically being harmful to the brain. And then I discovered that it's also harmful for the body. So it's not an independent, the brain is not like an independent, unit that you cut off. But even though insulin works very differently in the brain from the rest of the body, glucose works very similarly everywhere. And so there was a clear connection there. And then I started to cut carbohydrates back as well, and went on the low carbohydrate diet first, and the ketogenic diet, and then the carnivore diet. And sort of, trying everything, I came out to what is the ideal diet for me. And I designed the ideal diet for migraineurs who are just starting to get away from their medications and starting to move on to the low carbohydrate diet. So this is where the Stanton migraine protocol is coming from. It's basically my experimentation on me. And then a couple of people joined me and tried it also. And then it worked. And I created a book, my first book, which is no longer sold except as an antique relic. It's sold, which was very small, green little book. And that was just my story. It was not a manual. It was just my story. This is what I did. And that was extremely popular. It sold out very, very quickly. And that is what started the movement of the Stanton migraine protocol.
So the way I get it is like you mentioned sodium. So it's a problem with the sodium, and then this is affected by the levels of glucose in the bloodstream, which by itself has an effect on the levels of sodium because of the transport of glucose across the cell membrane. Did I get that right? As I said earlier.
Right, it's correct. And very few people know that. We all think that insulin does all the glucose delivery out of the blood into cells, but that's not true.
Yeah, that's right. So it is not, in reality, it's not very much known actually to many doctors actually the world over. But in this aspect, the way you explained it pretty well, the low carbohydrate diet would then do wonders to migraine patients. Would that be so?
Yes, it is. But with a caveat that they still need to increase salt much more than any other person. So no matter what way a migraine sufferer starts eating, they need to increase the salt, but not in the food. They need to increase it in water, because you don't want the salt to be going into the cell through the intestinal absorption with the foods. You want the salt to enter into the blood very quickly to create electrolytes. And so you'd want to drink the salt with water rather than eating it with the food. So there's an importance there. But otherwise, a low carbohydrate diet is basically, and there are many kinds. You've got the standard low carb, high fat, you've got the ketogenic, the carnivore, the paleo. There's a whole lot of variety, and not all of them are good for migraine.
So from your own experience, and perhaps that also your cohort of clients and patients that you have intervened using your Stanton migraine protocol, what would you say would be the best diet for somebody who is genetically predisposed to have a migraine headache then?
I would say that at least to start with, it should be the carnivore. Now, the carnivore diet is an all animal diet, and it includes dairy, eggs, every kind of animal that you can think of, including insects. Like I happen to love eating crickets. So there are a lot of, yes, roasted crickets. So there are a lot of things you can add to it. But I find that very particularly a higher protein and lower fat. So not ketogenic, but very much, and it's not carbohydrate free, because in muscle meat, we have a lot of glycogen, even if it's not listed in the guidelines that there is, but it's actually there. And so what I find that eating, if somebody starts with, say, the ketogenic diet, the problem is going to be that there isn't going to be enough glucose, because the migraine body is so carbohydrate intolerant that there's a major problem with glucose management and glycogen management. So I find migraineurs tend to get sugar crashes all the time. Excuse me. And so for this reason, to prevent the sugar crashes, I recommend the carbohydrate diet with a high protein carbohydrate. I'm sorry, high protein carnivore diet.
So is that also the same experience among your cohort? I understand that you have this Facebook group wherein you are actively engaging with them, especially in relation to the dietary recommendations, as well as the electrolyte recommendations that you are proposing with the Stanton migraine protocol. So being a migraineur yourself, would you give us an overview of, from your own point of view and your own experience, what do you actually do? What do you eat?
Okay, so I went through every single kind of diet you can think of. So I started with the low carb, high fat, Then I went to the ketogenic, then the carnivore, and then what I call, excuse me, something in my throat, what I call the hypercarnivore, which is basically carnivore with a very tiny amount of fruits and vegetables, just a couple of grams a day. And of course, fasting in here and there. So what I found that for me, the best way to eat is only twice a day. So I skip my breakfast every day and I eat the hypercarnivore, but I seasonally adjust. So in the summertime, I will increase carbohydrates, and in the wintertime, I will cut them out.
So fasting also does wonders to prevent migraine. Is that what you're saying?
Not really. I think fasting is more to sort of reduce the insulin level and reduce the metabolic disease, but it doesn't really do any good for migraine. So with migraine, the important thing is to cut the carbohydrates as low as possible, specifically plant carbohydrates, and increase the salt. So any way one can ensure that the carbohydrates are cut and the salt is increased is going to be beneficial. And so if somebody is choosing to eat just low carb, high fat, which is our standard protocol in my migraine group, which eats between 50 to 70 carb grams a day. So it's a standard low carb, high fat. It's good and it's sufficient, and people can manage really good as long as they are very careful how they eat it. And for example, they shouldn't be eating salt with carbohydrates. So if somebody is eating vegetable, for example, which is high in carbohydrates, they should not be salting it, because when glucose enters the cell, salt is removed. So if they take in more salt, it's going to take the glucose faster into the cells, and more salt is going to be removed from the cell, and more water is going to be removed, and this causes edema. And so the biggest problem for migraineurs is the edema that ensues as a result of eating carbohydrates. So if they reduce the carbohydrates and increase the salt, they are fine. The ketogenic diet the only reason why the ketogenic diet is not really the preferred diet, especially at the beginning, is because many migraineurs are still on medications, and ketosis interacts with many medications. So favorite medications, for example, for migraineurs is topiramate or Topamax, and that medication is even labeled to not prescribe it for the person who is in ketosis or is on a ketogenic diet, because it can end up in kidney stones. And so I have to be really careful with what I recommend with people coming into the group, because if they're on medication, I don't allow them to get into ketosis, because we don't know what kind of interaction they may end up with, and I don't want to take a chance. And so I don't recommend the ketogenic diet or even the fasting for people as long as they're still on medication, and also as long as they still have migraines. Because, for example, if somebody has migraines and joining my group and suddenly decides to, okay, I will quit all carbohydrates, all grains, everything that I need to quit, and I will go on a low carbohydrate diet, and I will start by fasting, then the first day of the fast, that person is going to have a sugar crash. And that sugar crash is going to cause a migraine that will last 3 to 5 days. And so it's not that fasting is not a good thing. It can be a bad thing, especially at the beginning. And then once the person can fast, she no longer has a migraine. So I separate the two, because I want to be careful to not get sugar crashes. And I find that migraineurs tend to get a lot more sugar crashes than the general population. They seem to have what I call the hyperinsulin response. So in my Facebook migraine group, I ask everybody when they join to ask their doctors for a blood test. And I have a big list of what I would like to see. And then they share it with me so I can see where they are in metabolic health. And I would say that 90% of, or maybe 95% of the migraineurs coming in have perfect insulin. They're low-level insulin, low-level C-peptide, A1C is perfect. So you would think that they don't have metabolic disease. But then I also give them a 5-hour postprandial test this is similar to the Kraft. I don't know. Are you familiar with Joseph Kraft and his test? So I do the same. Yeah. So
many doctors should know that.
They should know that, but a lot of them probably don't. So basically, what Joseph Kraft did was a 5-hour postprandial test. It was an oral glucose tolerance test, but for 5 hours, not for 2 or 3, which is more typical today. And he would test for insulin and glucose every hour for the 5 hours. I can't do that because I'm not a medical doctor, so I don't ask for a very specific test like this. But what I asked them to do is to eat a low carbohydrate diet or whatever food they eat. So when they join the group, they eat what they normally eat. And they write down what they ate. So I have the macros, I know what nutrients were in the food and how much. And then they do the 5-hour postprandial test, but I do it for every half an hour. And I check the glucose and the ketones because ketones correspond with insulin. They oppose each other. And so I can use ketones as a proxy for insulin. And together with glucose, I get a really good idea of how they are in metabolic health. And as I noted earlier, 95% of the people coming in have perfect insulin. And you would think that they're very healthy. Some of them have low insulin, and you would think, lower than you would consider it even normal. But when they eat, and you do this Kraft equivalent test, they have huge insulin spikes and they end up with sugar crash. They end up with sugar crash, they end up with reactive hypoglycemia, even from a very minimal amount of carbohydrates, say in a glass of milk. And so it is very critical for them to keep their blood glucose even, to not have changes too much, because that can cause an electrolyte disturbance, and that's going to cause then a migraine. And so the goal is not any one specific diet, but whatever diet the person can do that keeps their blood glucose stable continuously.
So keeping one's blood glucose stable is paramount then towards controlling and preventing migraine. So with respect to that, continuous glucose monitoring, or CGM, is more commonplace now. I think they're in the United States also, and more patients, and even those who don't have diabetes are also getting into the, some say it's a fad, but for me, I have many patients already doing continuous glucose monitoring. What's your experience with regards to CGM? Have you experienced it yourself and among your cohort of patients?
Right. So I experienced it myself, and I didn't have a very good experience because this was a couple of years ago, and somehow the CGM was not adjusted properly, and they kept on adjusting it, but then it was giving me really false readings, and we were not able to discover what was right or wrong. And the other problem that I find is that, of course, because I look for both blood glucose and blood ketones, the person still has to prick her finger or his finger. So they still have to go through the regular. So what we do is many of them use CGM for their own benefit. So they can tell if they have a sugar crash or if they have very high glucose. But I find that once you're on the low carb diet, be it the low carb high fat or the ketogenic or the carnivore, the blood glucose is stabilized pretty quickly. And some variations with some sugar crashes at the beginning. But those are usually felt by the person, like they feel a little bit shaky or feel a little bit nervous or something is different, and they check their blood glucose. We ask everybody to check their blood glucose and blood ketones several times a day at the beginning so that we get an understanding and they get an understanding of what sensation comes with low blood sugar or with a high blood sugar. And so I personally found it not overly useful because it's not detailed enough. And also because it is measuring the glucose not in the right place. So what I mean by this is that when you have a continuous glucose monitor, you would snap it into your arm or in your abdominal, and it's usually in the fat. It's not usually in or around the cell. And it's definitely not in a regular venous artery like you have in your arm or a capillary like in your finger. And so you're not testing the same thing. And in addition, the other part, which is I find fascinating and it's very seldom mentioned, is that the heart, with each pumping, each heartbeat pumps the blood a lot. And so in a main artery, a single heartbeat can take the blood about 60 centimeter. That's huge. And so, of course, it slows down by the time it gets to the finger and gets anywhere else. But when you're talking about the fat tissue in the arm or the abdominal fat tissue, the subcutaneous fat tissue where the CGM is inserted versus where you're looking at it like on the side of your finger, it's going to be in a different place. And so I'm finding that the blood glucose is not as relevant here as it is here. And so the difference is not just in the numbers in terms of the quality, but also because it's a different kind of a tissue. And so I think that while it is very useful for some people who are really having type 2 diabetes at a really high level, or type 1 diabetes, and they want to predict and understand their system better, for those people who are just about almost normal, I'm not sure that it is as useful as, at least I haven't found it to be overly useful.
So in your own experience, Dr. Stanton, how would you say, what is your estimated percentage success rate in really controlling migraine among your cohort of patients?
Well, I have to say that if the person follows the protocol 100% to the T, then the success is 100%. So I have not had
Impressive.
a person. It's very impressive, but there's no alternative really, because we work with a person as long as it takes to make sure that they end up migraine free. So it's not like a person goes to a doctor like you and you have a limited amount of time to spend with a person, and then the person goes home and whatever they do. That's not what we do, not what I do. So I donate all my time, and everybody in this group is donating their own time to help others. And so what we do is we are with that person all day long, every day, as much as that person needs us and is communicating with us, and we walk them through if they ate something incorrectly or wrong, or deliberately they had a party and they couldn't help it but eat some cake or had some alcohol. We will walk through and we'll help them, and they learn what to do. And then once they learned what to do, then they will never experience another migraine.
Impressive indeed.
It's a lot of work, though. It's different from what you do.
Yeah, I think more and more neurologists should hear about you. Any studies that you have done or are currently doing with your cohort of migraine patients with regards to, electrolyte, low carbohydrate control, and the outcomes?
Well, so yes and no. I don't consider the Facebook migraine group as an experimental subject, so I can't really use it as experiment. But what I do, and what those who are willing to participate, is that we experiment eating different foods to see what actually happens and what is our response. What can we do? How can we make that migraine disappear if we ended with a migraine? What amount of fruits and vegetables, for example, one could eat in the summer and then not eat any in the winter? Like, how is it going to move back and forth between changing from eating a high carbohydrate diet to suddenly move to the carnivore for the winter, and then back again in the next summer to eating fruits? And so little mini experiments. And so, and also we are experimenting with supplements, for example. I am not a fan of supplements. And so I created a couple of basic supplements. Basically, I created them for me, not for the group. But then in order for me to buy my own from the pharmaceutical company, I had to buy a truckload of, for example, electrolyte, which is just salt in my case, in a capsule. And when I wanted to design a magnesium for me that I couldn't buy in the store, then I had to buy a truckload of magnesium. And so my son, my older son, decided to give it to me as a gift instead of me buying it. And then, but that was so much that he said, can we sell some of this to some of the migraineurs? And I said, sure. And so he started the company. I'm not connected to it at all, but I'm designing these supplements basically for me. And then he's putting them available for other people. And that's a very successful company selling these products. And so we experiment on adding new supplements that may help migraineurs. So for example, the latest addition in supplements that helps migraineurs is a high DHA fish oil, not any fish oil, but very specifically high DHA with EPA in it. And we found that, first I experimented with it, and I found that taking the DHA supplement like that tremendously helped me sleep, because migraineurs have a very active sleep. So our REM sleep is, if we can have a lot of nightmares, and it can be very difficult because of our hypersensory neurons, the sensitivity is going to be remaining high at night. So we sleep very lightly. And I find that using this, I found it myself that using this DHA helped me get a better sleep. And then I told this to the migraine group, and then some people started taking it, and then they felt better. So now we are recommending it to other migraineurs. So these are the kind of experiments that I run that are not really experiments per se, but just improving, how we can improve the life of a migraineur.
It's been tremendously amazing to hear all that from you, Dr. Stanton. I'm sure many of the audience that we have here in the Low-Carb Health Doctor podcast would appreciate learning a lot from all those that you shared with us today. How would people get in touch with you should they be interested to also learn more about your protocol and perhaps even be part of your group?
Well, they can be part of my group, and the group on Facebook is called, if they go to Migraine, to Facebook, they can go to Facebook/groups/migraine sufferers. The full name of the group is Migraine Sufferers Who Want to Heal by the Stanton Migraine Protocol. And of course, they can get a hold of me via Twitter, where my handle is @migrainebook. They can send me a message on my website, which is stantonmigraineprotocol.com. And then I also have a nonprofit, which I haven't mentioned yet. And in that nonprofit, I run fundraisers every year, and I don't take any of that money. All the money that is donated goes to needy migraineurs. And unfortunately, I can only provide supplies to American migraineurs, because internationally, I'm not able to send any gifts to anyone. But locally, the nonprofit buys, for example, the blood, glucose, and ketone testing kits to migraineurs who can't afford to buy them, buys the book to migraineurs who can't afford to buy them. So we help the migraineurs in the migraine group. And so the funds go toward that. And that's stantonmigraineprotocol.org. And then they can, of course, email me at angela@migraine-book.com. So these would be the best ways to get a hold of me.
What would that be again? What's your email?
Angela, the email is angela@migraine-book.com.
Okay, we got that. So thank you very much for this opportunity to have you with us here in the Low-Carb Health Doctor podcast, Dr. Stanton. It is indeed a great honor to have you here, and I hope to have you back again soon and discuss more about migraine headaches from a probably more technical neurologic aspect.
Thank you so much for Dr. Akropa. It was really wonderful talking to you. Thank you for inviting me.